Into a surgical robot called the Da Vinci, the only one of its kind. Last year, doctors in every state used the Da Vinci in more than 700,000 surgeries for everything from heart valve replacements to hysterectomies. But are they safe? And are doctors properly trained to use them? Our senior investigative correspondent, Cynthia McFadden, has that story for us.
There's no question that the Da Vinci surgical robot, seen here in a marketing video suturing a grape with precision and ease, can do extraordinary things. The only surgical robot of its kind. Many doctors, like heart surgeon Dr. Robert Poston, seen here using the Da Vinci, are believers.
The patients recover quicker, less blood loss, there's less complications.
That's because there's no big incision. It's laparoscopic surgery on steroids. The robot controls the instruments guided by the doctor at a console.
My ability to be precise is better, even than my own hands.
But the Da Vinci is not without problems. In the last 10 years, there were 22,000 adverse events filed in an FDA database citing a range of issues associated with the Da Vinci, from the most minor malfunctions to 274 deaths. Lori Featherstone, who lives with her daughter in Altoona, Iowa, wishes she'd asked more questions before having robotic surgery.
As you sit here right now, are you in pain?
Yes.
All day, every day.
Sorry.
3 years ago, her doctor told her she needed a hysterectomy.
She told me that I needed to choose whether to have a robot or a surgeon. And if she were me, she would elect to have the robot. Less downtime, less scarring.
But Lori had serious complications.
Basically, my kidneys were drowning. They had found that my ureter had some type of thermal injury.
So somewhere in the course of the surgery, you were burned.
Mm-hmm.
Her doctor's post-operative report confirms that, also noting her colon was damaged. She's now facing a permanent colostomy. All this 2 years after Da Vinci's manufacturer, Intuitive Surgical, had been put on notice in a strongly worded letter from the FDA that, among other things, burning was a problem. Sadly, Lori is not alone. NBC News has spoken to more than a dozen patients, many of whom are suing, who say they were burned or otherwise injured during surgery with the Da Vinci, something we saw reported over and over again in FDA documents. Surgeon observed a flame, burn injury to small bowel, a burn injury to the liver. And while Dr. Poston has now performed 1,200 surgeries using the Da Vinci, he tells us before doing his first, he had only 2 hours of practice on the device and is extremely worried about the lack of doctor training.
If you want to fly a commercial airplane, it takes you 1,500 hours, but you can fly a robot after training, which isn't really that rigorous.
In fact, there are no national requirements regulating how much training a surgeon must have to operate using the Da Vinci. The FDA says it doesn't have jurisdiction. And while Intuitive Surgical offers a 4-level training program, it cannot require surgeons to complete it.
The root cause here is the training. The willingness to sell robots to people and promote them doing surgeries when they weren't adequately trained. The willingness of hospital credentialing committees to sign off on them and allow them to do it.
Dr. Poston hopes every surgeon will search his or her own conscience.
We should live in a world where we practice brutal transparency with our patients. So if we lived in that world, we would tell the patient, I'd like to operate on you, but I didn't have the time or money to have all the training that I really think that we ought to have had. Is that okay? Is that okay? Would you be okay with that?
The robot's manufacturer tells NBC News that they, quote, offer a comprehensive, intensive training program that depends on the surgeon's capabilities, and that they also strongly recommend that surgeons continue training throughout their careers. Now, Lori Featherstone filed suit against Intuitive, but later voluntarily withdrew it. She says, ask questions.
All right, Cynthia, thank you. We're also